bring back the,
How do I?
where'd it go? Is it up here?
There you
There
are.
we go.
Are we live?
Meeting is now streaming live. We should get a notification soon.
Yes. Hello, everyone, and welcome to this very special edition of Two Crazy Cat Ladies interviewing Dr. Roman.
The one and only Dr. Margo Roman. For anyone that follows us at all, you guys know how excited we've been about this interview. And we had the distinct pleasure of actually getting to chat with you, Dr. Roman, a couple of weeks ago. And really, it was just a great experience. We could talk to you all day long. So today in particular, though, we're going to be discussing three big issues that our kitties have, which is behavioral issues, allergies, and IBD. So those are big issues. But I wanted to, no one can do an intro better than you. I'm a little fangirl right now. I just got nervous. Just because I'm such a fan of the work that you do and the path that you've been on. Could you take a couple minutes and just share with everybody who you are, kind of what brought you down this path, where your passion comes from, and a little bit about your background?
Okay. Well, my name is Margo Roman. I graduated veterinary school from Tuskegee in 1978, but I always wanted to be a veterinarian from childhood. And so, and I wanted to be the kind of veterinarian that really cared about finding solutions. And as someone who was sort of scientific, but also really was in love with my cats and my dogs, I wanted to find something that I could help them. So that, starting out very young, that was a drive that drove me to go to veterinary school. And I was very fortunate in veterinary school to be the first woman to take the veterinary acupuncture course in 1975-76. And it was an eye-opener. I was still a student. And so to see another modality when you're first beginning to form your ideas about how you can care for an animal, suddenly there was another whole book that opened up, and you weren't confined into your space of what you learned in veterinary school is what you are going to do the rest of your life. And so by opening up that door, I then was able to open up the homeopathic door and the herbal door and the chiropractic door and now the ozone and all these different components. You start realizing how valuable the body is and how it wants to be healthy. And it doesn't want all this chemical stuff and all this drugs and everything put inside of it. And as we realize now, and many people are understanding that, you are what you eat. You are what your body puts into it. You have to take care of that body, and adding more things to it that actually suppress things and aggravate different situations by suppressing one and pushing another one up, you actually are harming the healing process. So by learning all these modalities, it just sort of gave me another opening. And the concept of using medical ozone came into my practice in 2003 when my horse had cancer and was told that there was nothing else I could do. He was going to be dead in a few days. And he lived 2.5 more years jumping in horse shows. He had already lived 7 years from the first diagnosis of cancer and was surviving another 7 years when he was supposed to be put to sleep at 16 when I got him. So he lived all these years with integrative medicine and not just giving up on him and saying there's nothing else you can do. So that's when I start to look. When another vet says there's nothing else you can do, I'm like, okay, what can we do? Because I am not going to give up. How do I know there's nothing else you can do? Have I explored everything? Has the owner explored every avenue? But it's very frustrating when people just hear, okay, that's it. I don't have to do any more. The vet said there's nothing else you can do. So what happened was I had challenged myself for about 10 years to do a fecal transplant, to use the microbiome. And my own dogs, who I had raised, my standard poodles, to try to see if I could improve the breed by feeding them a whole food diet, not over vaccinating them, not giving them pesticides. We live in a green home on forest we built ourselves the house, and the forest is an old growth forest. So it's very clean. And so I've been raising, 27 years, been raising standard poodles and trying to make the next generation better, because as a homeopath, they say it takes at least 3 generations and up to 5 generations to really clear out the miasms or the difficulty that's damaged the DNA. So I figured here I'm at my 5th generation. But at my 3rd generation, I decided to do a fecal transplant on a dog that was dying. And it turned around completely. And I was like blown out of my mind that this dog, and then we did another one and another one, and we added the cats, and we started, and we saw this, this whole flip of their immune system. If 80% of your immune system comes from your gut, what's the first thing you should do?
Right. Heal the gut. Right. Yeah. For those that are newbies to this this whole like mind-blowing word of fecal transplant or fecal therapy.
Oh, that's right. Okay.
Yeah, because first time I heard it, I was like, what did you just say?
Right.
Could you briefly explain what that is?
So when I heard the word fecal, it's fecal microbiota transplantation was the word that was coined about 3 or 4 years before I coined the word microbiome restorative therapy. Now, doesn't that sound a lot more tasty?
It does.
It does.
Yes. So I thought, well, I will coin this word, microbiome restorative therapy, because I'm not just giving them poop. I'm restoring the gut with nutritional support, with with things that I use to help the animal become more balanced. So instead of just throwing poop at them and giving a transplant, we wanted to develop the terrain of the gut and make it as strong as possible. So when all those new microbes, and in a normal human being, there's 100 trillion microbes. There are 500 species and 1,000 subspecies. So you're talking about this complex system that is almost like, the stars. I mean, it's like we only know the planets right now, and we have no idea what's past the planets. So that is how you have to look at it, because when we do cultures and sensitivity of the microbiome in a standard PCR, we're looking for 6 things. There are 500 things there, and we're looking for 6, and we say, oh, you have this one. Well, or you don't have any of them and you're fine. It's like, you don't even know what you're talking about, because it's not that, the science has to catch up to what people, some of the scientists have realized. And that is going to take some time, because you're talking about all this DNA and RNA, and which species reacts with another species that reacts with another species that maybe will prevent cancer. We don't know this stuff. Right. This is all really new frontier. So it's very exciting to sort of give the microbiome to animals that have been on antibiotics, that have been on a lot of drugs, that have had a lot of intervention with surgery, that have been on, really bad diets, that have been trying to control one protein and not allowing it to have a lot of diversity of vegetables and things that could help and balance out that cat's GI tract and allow that GI tract to heal. And that's what we're trying to do, is allow it to heal by restoring it. And that's really the whole thing. And the types of cases we see just are really impressive. And it just giving, in the wild, your cat would eat a mouse or eat a rabbit or a squirrel. And my dog, we were just talking about that. But, and they would eat the whole intestinal tract of that mouse. It's not like they would only pick off the meat and peel it off and only eat the meat and not eat the hair and not eat
or cook it.
Right. Right. And go out with a little shish kebab and put it on shish kebab and, and then pull off just the meat. They're going to eat that whole thing and almost whole, and so all the bacteria that's inside that mouse is going to be partially digested and partially assimilated. And so that little mouse who's eating the little grains of grass seeds and everything else is breaking it down. And then that cat is going to consume that mouse with all those microbes that are in that mouse. And then hopefully some of those will feed their microbes.
Yeah. So but when we're talking about fecal matter, and how would you explain it for like in first grade terms, for somebody that's never heard it before? What are we doing with the poop? What are we doing with the shit?
In first grade terms, we all have potty talk, right? So we're going to do some potty talking. So potty talking with dogs, I had a client that came in and said, I told her the dog needed a fecal transplant. She literally thought I was going to open the dog up, open its abdomen, take the intestines out and transplant it. Yeah. So it's very simple. We do it with capsules. So we're inoculating like a probiotic would be, okay? But a probiotic is 4 species, 6 species, maybe 10 species. The fecal is 500 species, and they're all symbiotically balanced. So we can do it by capsules. We can do it by slurries, where we do it rectally. And what we always try to use in our practice is medical ozone, because medical ozone it kills viruses on contact, bacteria on contact, removes the biofilm. So we put it in there to clean out the area of the intestine that we're then going to put a slurry in and mix it, allow the cat to defecate whatever was in there, put this new stuff in, massage it gently up and down the cat's colon, and allow that to blend together into the wall of the colon with in the crypts and everything else that are there. And you're hoping that you can keep the cat from using the litter box overnight. And that's my goal. That's the hardest challenge with cats, because you don't want them, doing something bad in the house. But if you can not encourage them to go to the litter box, like let them go and then take them out of there. Like they're, usually when they pee quickly, and then they may take more time to figure out where in the box they want to poop. Then you just, like distract them.
Distract them.
Try not to let them go at all, into the litter box for more hours. So if I can keep them overnight without pooping, that's my goal, to let them go through a parasympathetic system where they're resting and they're not in any kind of action. They sleep and all those little microbes start to like, oh, I know you, and and where have you been all my life, kind of thing, and mesh together. And that's sort of how it works. And then we basically prepare the terrain of the gut with really good nutraceuticals, with this product called Gut Ion, with Colostrum, with vitamins and nutritional stuff, and feed them a fresh organic diet, because most of you probably feed commercial food and it is full of chemicals. It's full of glyphosate. It's got fluoride, most likely, because they're using regular water or chlorine. And if you have fluoride and chlorine in your water, which most people do because they live in cities that do stuff to the water, those are antimicrobial. What is it doing to your cat's GI tract? Cats were not, they slept, they went into streams. I mean, now streams are probably full of pesticides and everything else too. So these poor animals don't really have good, clean water. So giving them good, clean water from a clean well or spring water is probably better than, mixing in tap water from one of the big cities that uses all these chemicals.
Yeah, that's a super good point, because, a lot of times we'll be like, well, my cat maybe had antibiotics once. It's not like really a big deal. But when it comes to the quality of the water, I mean, our water has antibiotics in it. So a lot of our cats, their guts have just been destroyed by simply drinking the water that we're giving them, because we're unaware that the water that we're giving them might be, even filtered water. Doesn't take out all of the chemicals within.
Yeah, it's better than if they, and like in where I am, I have my own well. So we haven't had it tested recently, but we had it tested a while back. And, and I have a reverse osmosis, so in a house filter. So, they're still getting minerals in there. I'm hoping, that because we have a large piece of property and don't put pesticides on it and have never put any herbicides or any pesticides on it, that the water is cleaner than somebody, a mile from here who's spraying their lawn with Roundup, because right. Roundup is terrible. Roundup, actually, if any of you out there are using Roundup, you are causing really harm to yourself and to your family and to your pets. And it's glyphosate has a patent as an antibiotic for the intestinal tract. So if it's got a patent for that and your cat is walking through the yard and getting exposure to that and then licking their paws, that cannot be a positive thing.
No, not at all. In fact, one of our followers just last year had a cat that would go out and drink from their stream, and she had a very clean yard, didn't use pesticides or anything. But the new neighbors up the hill right behind her had just done like 10 rounds of Roundup, and it
drained into the stream.
Right, it drained into the stream, and the cat was like immediately in kidney failure.
Yeah. So I'll tell you, those of you that are watching this, don't be afraid to go to your neighbor and say, aren't you seeing the commercials for the lawsuits against Roundup? I mean, it causes lymphoma, but the big part is it causes your GI tract to not work. So if 80% of your immune system comes from your gut, so what if you have a few weeds in your yard? So what?
No, we like to plant
weeds. Really healthy. They're really healthy to eat, and they're something that you can gain nutrients as well as protect your liver with it. And meanwhile, we're trying to kill them all.
Right.
Hey,
Okay, so back to the fecal therapy here. Yeah. So we told everybody that we are going to talk about these 3 subjects today,
Okay.
and I'm super interested myself into seeing how, I think I get the IBD part, but each one of these different issues, how this specific breakthrough treatment can actually help cases like, and number one, I want to talk about allergies, because that's a huge one with a lot of our followers.
A case about Mojo. Mojo put together a lot of the different pieces of my case, and he literally blew my mind. So Mojo was a Maine Coon cat that was about 6 years old, that had atopic dermatitis, had been on cyclosporin, had been on steroids, had been on all these different drugs over dermatologist owned by a very, very intelligent doctor who, doing the best she could for her cat. And so Mojo, she wanted to do the fecal transplant because I had talked about it. I said, I'd really like to do it. Well, I had not been doing too many cats fecal transplant because I had gotten my cat Trapper specifically to start harvesting him. But I got him as a young cat who was not a holistically raised cat, and kept giving him oral poop from my dogs to try to inoculate him so that he would be like part of the family, which, he I guess he got that. He got all the oral poop and he thought he was the mother of my dogs, so I taking care of him. But he was, so I didn't neuter him till he was a year old. So he was about just had gotten neutered, just neutered him like 2 or 3 days before I gave the fecal transplant to Mojo. Mojo had been neutered at about 9 weeks of age at a shelter. And so he's now like 6 years old. Miserable, nasty cat, and living in an e-collar with scabs all over. So anyway, we gave him a fecal transplant. At that time, it was really more just oral kind of. We weren't doing both ways. We were doing mostly rectal ozone and then oral. So she calls me like 3 days after she gets the fecal transplant on him. And she said, he stopped itching after 2.5 years. And I said, that's amazing. She said, no, he's not itching anymore. So I thought, that's great. So she calls me like about 2 or 3 weeks later, and she said, he's getting hair on his body where he hasn't had hair for 2.5 years. I said, that's amazing. That's great, right? We had added some things to his diet, but this was like so extreme. And then, so about 5 weeks later, she calls me and she says, I want to do it again. And I said, why? She said, he's happy. He's so happy. He hasn't been happy like this in so long. I said, well, you'd be miserable too if you lived in an e-collar and couldn't lick yourself and chew yourself. You'd be angry and mean and upset because you couldn't even take care of yourself, right? And she says, no, it's different. It's really different. And I said, okay. So she drives an hour from Cambridge back out to Boston. I give her another piece of poop from Trapper's litter box. She takes it home. She pops it in his mouth. And she calls me 6 weeks later and she says, I want to do it again. And I said, why? She said, he's even better than he was. I said, well, why do you want to do it again? She says, I'm a scientist. I want to see how good he gets, right? And I go, oh, okay, it's just poop, right? So she comes back out. I give her the piece of poop. She calls me 2 days later and she goes, there's a problem. And I said, what's wrong? And she said, must be something wrong with his anal glands. He's acting really odd. And I said, well, okay, just why don't you come out and let me see. So she drives out. I check his anal glands and I don't feel anything and they feel totally normal. And I said, please describe to me what you were seeing. And he was sexually mounting her arm. And I said, forget Viagra. I found the fountain of youth. And everybody's going to be standing outside high school gyms for, 16 microbiome, but it works. And so because he never in his life had ever had sexual hormones because he was neutered at 9 weeks of age, but the replacement of his gut flora was so amazing. And he was so friendly and happy and purring and everything else. And it was, to me, that put everything. So I started taking that knowledge and then utilizing my dogs when they were in heat and giving it to dogs that were old and, really old and having management of their cognitive stuff. And they're out humping their pillows and having fun. I mean, they were, so we think about how we treat our cats. We don't, now we're controlling some of the
spay and neutering in dogs and waiting till later, or not spaying and neutering. But in cats, we typically don't, because it's hard to live in a house with an intact male. I mean, I couldn't do it. It's just too strong, that of a smell. And females go into heat every, 6 weeks or something like that. So you're, constantly worrying about them jumping outside and getting pregnant. So, so it's harder, but it could mean that these cats are losing their ability to cycle in the normal way that they do. And one of my theories with the dogs now, we just got the dogs out of heat, is these dogs that have been spayed and neutered early, maybe once a year, you need to give them the microbiome from a dog in heat so that their body knows this kind of change that has to happen, and all these different microbes have to work together during the cycle of a normal, healthy life. So that's where, that's a piece that I'm looking at as well now, right now with the dogs. And so, to work with the skin and have their gut, the gut and the liver is very much related. The liver and the skin in Chinese medicine is very much related. So we want to enhance that connection between how the internal organs help with the skin and have it come out to the surface.
Yeah.
So we talked about allergies, and that's probably one of the best allergy cases. And I've had other cats. I had another big Maine Coon cat. This one's a really funny story too. And I try to remember his name the other day, but he's a big guy, big guy. And he never was really a very friendly guy, but in the office, he wasn't friendly at all. But at home, he was okay, but he wasn't like super friendly. So I gave him a fecal transplant when before my puppies were born. They're 2.5 years old now. Before they were born, the dog Vienna and the dog sleep together all the time, and they always sleep together. And so because he loves her, and that's why he goes and he hunts for her and he does everything for her. So she was always licks them and they lick each other and they take care of each other. So I gave him a fecal transplant. She calls me like 2 days later. She says, "I have not slept all night long." And I said, "What's wrong?" She said, "He's never purred like that in his whole life. He was on my neck all night, just the loudest purr. He's never done that before, just purring and purring and purring." She said, "I can't sleep. I had to put him out in the other room because he's so loud, because he's a big cat, right?" So I said, "That's wonderful." And she goes, "It is wonderful. He's never done that before." And his skin all healed up. So then when the puppies were born, Vienna would not let them in at all, let him in with the puppies. They're this big, and he probably thought they were rats, right? So he just didn't trust him. And so when he tried to walk in the room, she'd snarl and try to lunge at him. And he was like, "Oh my God, this is my child. They won't let me in and see my grandkids." He was so upset. He was so taken back by it. So he was walking around the house, whipping his tail, going, "Row!" And every time I tried to touch him, he would go, "Row!" And he was miserable. He was mean. And I was like, "It'll pass. Don't worry about it. It'll pass." He was mean. So she came back a few weeks later and said, "I wanted the fecal transplant." We gave him a fecal transplant from Trapper at that point. She calls me 2 days later. She goes, "Wow, I don't know what's wrong with him. He's walking around the house with his tail and growling at everything. He's just grumpy and irritable. What happened to this fecal transplant?" I was like, "Oh no, I can't have an upset cat. This is like, he can't be like that. I don't want to have people call up and say that I don't like the way you did this to my cat. He's now miserable," right? So that's when I started looking into getting him a girlfriend. So that's how I got Bliss. So I wanted keep him in bliss all the time. So keeping him happy. And so he sleeps with her, but he still sleeps with the dogs, but he has his girlfriend. So
That's so precious.
Something I so love about this and these conversations with you is, and I think integrative medicine is kind of new for a lot of people. I know that when I first started looking at it, it kind of feels like there's a lot of stuff out there. But what I love so much is that there's this acknowledgement that we don't know everything yet, but the bits and pieces that you do know, you start implementing in ways that make sense. And these stories of these outcomes and this approach to dealing with whether it's allergies, and let's talk more about behavioral issues too, like you're describing now, just kind of that tip of the iceberg idea of how much more there is available for our cats when we look at integrative medicine, and not just conventional, but integrative medicine, because there's nothing in this whole world better than a happy, healthy cat, and knowing that we're doing what we can to continue learning and to continue doing our best to improve. And you really, I mean, you really are just the tip of the spear on a lot of this stuff.
Yeah.
Well, to me, it's very exciting because it's, you can learn something in a book and you can never sway off of it. You can just stay on that and feel like I already know it. I learned it in vet school and this is what I do. But when I hang around my integrative veterinary friends from the American Holistic Veterinary Medical Association and from the Chi Institute and IVIS and all these organizations that are training veterinarians to know, the homeopathy group, the chiropractic group, there are all these people that are like, we want more. We're not happy with what we have. We want more, because it's really hard as a veterinarian to put your hands up and say, there's nothing else I can do. Just euthanize. And I can't do it. I can't just swallow that and think, okay, I've used all my intelligence up and I can't figure out something else. And, maybe I have, and then we're just hoping, that something will be better. But, you got to try. You can't just put your hands up. And so when I started doing the ozone and the fecal transplant and the ultraviolet, I always saw changes in nutrition. I always saw changes with nutraceuticals. And I felt that homeopathy was really helping give the energetic push to all this. But when you start to give more oxygen to the body by using medical ozone, and you start introducing this diverse symbiotic forest that's growing inside of us, that's taking care of us, how can you not utilize that to the maximum and still using antibiotics? So, today I had a case that's a dog that was at the emergency clinic, and the dog had they found some rods in the urine that was a catch sample, and they put the dog on antibiotics. Now this dog's been off antibiotics because last time it crashed with antibiotics, but they only have one tool. They only have that's that's actually the client. Let me just tell her 1 second. Hi, can I call you back? Okay, great, thanks. Okay, sorry.
Busy woman.
Anyway,
I love it.
So anyway, they want the dog on antibiotics. And I said, well, it doesn't have a white cell count, doesn't have elevated kidney functions. You found one piece of bacteria. The culture hasn't come back. To put the animal on antibiotics, if you have a nail and the only tool you have is a hammer, you're just going to keep hammering and hammering and hammering instead of saying, I want another tool for my toolbox. I'm not going to just throw antibiotics at something. Knowing that one treatment of clindamycin, this is research paper you can read, one treatment of clindamycin can throw your microbiome off for an entire year, and you may never get it back into balance. And what does every veterinarian do, especially veterinary dentists, is they put your cat on clindamycin after they clean the teeth. They have never cultured the teeth. They have never cultured the root. They have never done any of that, but they just do it prophylactically. And it should not be used prophylactically. We have so many other tools like ozone and, even just herbal flush. I use ozone, ozonated water to flush their mouth out and kill the biofilm of the mouth. But it's just, people need to just speak up and say, the government, APHIS, is telling us not to use antibiotics because we have so many resistant strains that are killing over 2 million people a year in the world from resistant strains of antibiotics.
Yeah. And the same goes for our pets. And
Right.
it's so sad. I mean, we've been in this industry for 15 years now, and that's probably my biggest pet peeve is, people take their cats to the vet. They're, maybe sneezing, or they have, like an upper respiratory issue or whatever it is. And they just throw an antibiotic, and it's like, do they even know? They didn't do a culture. They don't know what it is that they're treating. So then they go to a different antibiotic and try a different one. And then they go to a different
Most likely it's viral.
Right.
It's viral. It's not, we know we're learning now because of Corona, it's a virus. Antibiotics aren't going to really help us, right? So if antibiotics were going to help us, they would have everyone on antibiotics walking around on antibiotics. We know that doesn't work, or
Right.
think that everybody knows that doesn't work. So, we need to find ways to kill viruses in a way that actually helps the body stay healthier. So speaking about Corona, And I'm not allowed to speak as a veterinarian about human disease, but I can tell you about veterinary diseases. We have corona in cats, and sometimes it's related to FIP, sometimes it's related to other upper respiratory infections. So 15 years ago, I had a cat that came to my practice. It was a friend of mine. It was actually another Maine Coon cat. We've got Maine Coon cats a lot up here. So it's a Maine Coon cat kitten, Stella. And she'd adopted her from a cattery up in Maine. And the kitten came and it wasn't very healthy looking. Its belly was, it looked like a wormy, unscruffy kind of kitten, right? And so she brought it. We started on some vitamins. I gave it a little Ozone. I gave it a few things. And about a week later, the cat got really sick. And she was getting congested and everything else. So she called the shelter and they said, we broke out with coronavirus in our cattery. Most have died, and we're going to probably euthanize the rest of the 30 cats. There were 30 cats total. So they were euthanizing everything because they couldn't control this infection. So she said, they told me you have her euthanized. And she said, I'm already attached to her. She's like my family. I'm not going to euthanize her. So I said, well, let's try some ozone in a different way. So I had just started studying ozone. This was like 2004, yeah. And so I started to say, and I thought, well, we'll do it through, you can breathe ozone if you bubble it through olive oil. And it's antiviral, and you produce ozonides, and you can breathe it into your lungs, and they're using it for lung cancer, they're using it for pneumonia and viral pneumonia and bacterial pneumonia. So I thought, well, we'll do this to this kitten. And of course, I didn't want the kitten in my building with coronavirus. So I put it outside, I put the carrier, and then I put a plastic bag, and I pumped the air into it. And I could hear her just scrambling like all over the place. We took her out, and she was just coming out with gook out of her nose. And the owner drove home, and she said halfway home, she had to stop. And she literally said, I had to pull it out like spaghetti, like it was coming out of this cat's nose and its mouth. And she said, even the ears coming out of this cat's head. And in 2 days,
scary.
the cat was fine. The cat was like, it just killed all the virus, and the cat
Got rid of it
and had the ozone on board to help bring down the inflammation and all the other nutritional things. And she just passed away in January. She had malignant mammary cancer for 3 years. That's really rare that a cat can live with malignant mammary cancer. She also turned out to have this Plechner syndrome, which we can talk about, that a lot of cats are getting. And she ended up with that in her older age, at having that. And that probably is why she produced the cancer. So, but she lived 3 years getting ozone all the time for her mammary cancer, and and surviving through it. So anyway, but she lived 15 years after she was told she was going to be dead from coronavirus.
Wow,
just
that's
incredible.
amazing.
What was the syndrome you just mentioned?
We call it Plechner syndrome, and Peter talks about it. He's probably on here, but Peter talks about it a lot. It's a syndrome that I negated, and I didn't, and we can have a whole entire show on that. It'll go into like 2 hours, but it's an immune endocrine imbalance that Dr. Al Plechner described in dogs and cats, and they find it in people and other animals too as well. And it's a weakness of the adrenal gland, of the adrenal medulla, and a low thyroid. So it used to be that we never saw cats with low thyroids. Cats only got hyperthyroid.
Right.
So it was epidemic, the thyroid gland. But now with this test, we're able to test and see if they have this low thyroid, elevated estrogen. They have low IgA, low IgG, and IgM, and their cortisol level is quirky. It doesn't seem to match up, and a lot of people think it's insufficient cortisol. It's like an ineffective, or cortisol resistance. So it's complicated, and you need a vet who is willing to read this stuff and not throw it out when they first read it, because that's what I did for 3 years. I said, this doesn't make sense. And this was in like 1998. I read something that he wrote, and I literally thought it was quacky. And I thought, but then I had an animal that I tried all my things and did his thing, and oh my God, it turned around. And now we've treated over 500 or 600 animals with, diagnosing them with the way he diagnoses them. But because we use the microbiome, that has set up a whole different paradigm.
Wow, that's amazing. So before we leave out, we're getting a bunch of good questions. But before we leave allergies, I want to say, because we've always said, in the medical field, right? The definition of an allergy is the overreaction of the immune system. And but the immune system, 80% of the immune system is in our gut. So if we restore the gut, then we can we can typically possibly even cure allergies. It's not something, and is that only those that surface as skin, or what if it's like seasonal allergies that surface as like
So I
respiratory?
think that you know, if you can get the immune system better, then the seasonal allergies won't be so dramatic.
Right.
So people that constantly take, you know, Claritin and all Allerest and all these different medications are never teaching their body how to navigate through it. It's like, I got a problem. Oh, shut up. We don't want to hear it. Well, tell me about, you know, so how do you get your body to understand these are things that you live in the world with, okay? So let's get your body as balanced as possible so that, you know, cats should not be allergic to trees. I mean,
No.
dogs should not be allergic to trees. Cats shouldn't, you know, fleas, well, because we have so, you know, that's a common allergy, but that's a common parasite that cats have, you know, so should they be, one flea cause them to lose all their hair, you know, dig themselves up all over their neck? I mean, I don't think that's normal.
No, it's
You know,
definitely not normal.
no.
And a healthy cat, and it's also been proven, right, that fleas are attracted to the weakest of hosts. So we're actually dealing with somebody that she was using. We have a natural flea product, and she was using it, and she still, I mean, over and over, could not get the fleas under control in her apartment on her cats. And then she started giving just, you know, natural nutraceuticals to her cats, and in like preparation of like making sure they didn't get coronavirus actually. And now they're super healthy and the fleas went away. And she's like, okay, so that helps with fleas. And I was like, what? Oh, okay. I think it's just because your cats are healthy now and the cats aren't, the fleas aren't attracted to them anymore.
Exactly. They want the weakest. They want to attack the weakest and suck off them.
Right.
And take their, you know, and so it's, you know, if people start thinking in that direction, you know, how can we keep everybody healthier in the world? And animals, humans, you know, that's the one health method that the AVMA wants us to look at, is how to, you know, how to keep everyone in the family healthy. And if the animals are educating us and giving us information and insight, let's learn from them. Let's, you know, let them teach us things.
Yeah, absolutely. So now how does the fecal transplant help behavioral issues?
Well, you know, there's the gut-brain connection, and that people can go online and put in the gut-brain axis. And there's a lot of research that's going on, lot of research. And, you know, giving, if your serotonin levels and your oxytocin levels are in relationship to, are precursor. And you know what oxytocin is?
No.
So oxytocin is they call it the love hormone. So it's the part that the mother produces to let milk come down. So it's what they use to induce labor, but it also induces the mothering behavior for everybody. Hold on one second. Let me just see. Oh, I'll have to call him back. Okay. So anyway, so the, you know, that whole piece there is this relationship of this oxytocin. So this was early. This was one of my first behavior cases. I had, and it's not a, I'm trying to use my cat ones, but this was a dog. So this was a dog that had actually Pleckner syndrome, that was extremely aggressive and very, very difficult to live with. And his sibling, a leather wire hair fox terrier, they got the two puppies to live together, and the male would try to kill the sister. I mean, tried to kill her. I mean, gets on her neck and so they lived in an apartment. One lived in one room. They had to walk them separately. I mean, it was, how do you live your life like that? You know, and with two dogs that you thought would love each other, right? So and he was very allergic to all these different foods because he had this Pleckner syndrome. And so we gave him a fecal transplant. 2 days later, she calls me and she said, he is grooming her, licking her ears, cleaning her, looking at her like, oh my God, you're the most beautiful thing I've ever seen in my whole life. And was perfectly, I mean, he could eat everything that he wanted. He was in love with his sister. She was like, this is the dream I wanted. You know, this is the two dogs that I was planning on getting, not two that I have to keep apart and only feed them one protein. He was perfect for about two weeks. She couldn't believe it. And then she gave him an Inicept, which is the heartworm preventative, right?
Oh, yeah.
They're using this on cats too as well, right?
Yep.
They gave the Iniceptor to the dog, and about 24 hours later, he almost killed her. They ended up at Angel Memorial. He ripped her apart, just ripped her up. And so the connection was here, I went to one of the first lectures where they presented Interceptor. And one of the comments from the researcher was that it was a drug that was used in Japan, and its side effect kills parasites. So I always ask questions. I said, what was it used in Japan for? They said it was an antibiotic for the intestinal tract. So I was like, oh my gosh. So what are we doing when we put these flea products on our cats? What are we doing when we give them heartworm pills in certain parts of the country? We are killing their microbiome. And if their microbiome is 80% of their immune system, we're not helping them.
Yep.
Not giving them something that has, you have to look at the pros and cons of what you're giving.
Yeah.
Obviously, if you're in a crisis, you do an emergency anything when you're in an emergency. But if you're trying to build an animal's immune system, work with the animal's immune system. Don't just try to push it down high and low enough that you can get the animal to walk through that.
Exactly. Yeah. And going back to the flea thing, that's what we always say. We're like, now follow me here, but fleas are attracted to the weakest of hosts. If we use these chemical flea medications, it's going to weaken your cat's immune system. And now your cat is more susceptible to fleas as soon as it hears
and keep going back and going back and going back. And it's just so
but
sick.
We don't know what those things do to the microbiome. It kills fleas. What else is it killing?
Right. Exactly.
What else is it killing?
Yeah. And we know it's not safe for kittens. So why is it safe for cats? If it's these chemicals.
It's that toxic.
Yeah.
So but people, fleas are a problem, but, again, try to make your house as flea resistant as possible. So you may have to get rid of some furniture that is, I had another client that called me 2 days ago, and she's flying back to Los Angeles to move back to East, and she rented the house, and somebody had a cat who had fleas. Now the furniture is infested with fleas. Wow. And I don't know if you should take it back. Have it shipped all the way across country with this couch that's infested with fleas, because she's very holistic and she doesn't want to spray it with all these chemicals and have it, so we were having this long discussion. I had some fun suggestions for it, but we can talk about it, but we can do a whole thing on that, but we got to get rid of that topic.
But yeah, well, the behavioral thing though, because I find this so fascinating, especially when you're dealing with issues like aggression. And I think that a lot of multi-cat households have this situation where it is, they've tried to do the introduction, they've tried to do a reintroduction. And there's one cat that has like an arch nemesis, and if the two cross paths, then
I'm hoping, this is my thought. I haven't done a lot of that with the one cat in a group of 5 or 6 is the aggressor. But another case that we're talking about, behavior and irritable bowel, which we're going to segue into, and this is a very good case. This is Tober, and Tober, she's a calico, really beautifully marked calico, really, really pretty cat, and she has had diarrhea for almost 2 years.
Oh my God!
She has to clean her litter box between 10 and 20 times a day, and I thought she was exaggerating.
Goodness.
She literally it's like a splat across the whole thing, right? And the cat won't come up from the basement, hates the dog. It will hiss at the dog if the dog gets near it. And she's just living in the basement. And this cat, and she says she's like a feather. She's so thin from just having such diarrhea that when you pick her up, she poops and it runs down her leg, the woman's leg. So this is her description of the cat. So we did the fecal transplant on this cat. And we tested for Pleckner, which we eventually got these tests back, but we did this before we had all the test results back. Gave her the fecal transplant. She sends me a picture of a little pet, like a penguin sitting on top of the sandbox, like this perfectly formed poops. She was so proud of this penguin of this poop. She was like, "You got to see these pictures. I've never seen this on this cat." And they're like perfect poops. Right. And I thought, well, that's what I expect. Right. I don't expect anything. It's what I expect from all the prep that with the nutritional. But the part that really blew my mind is she said, "I cannot believe this cat's changed personality." She came up from the basement and is sleeping next to the dog on the couch. Now that blew my mind.
Yeah. Well, I mean, it's that gut mind balance. Well, and if you think about it just on a simple level, you think, if you don't feel good, you're not happy, I mean, it's, I mean, we talk about this when it comes to stressing cats, that diet can help the stress that your cats go through because of that, that connection. And when your cat feels good, your cat's going to be, and it's the same with us, if I eat a whole lot of carbs or unhealthy foods or whatever, I'm much more cranky than I am when I'm eating healthy foods and, taking care of my body.
Right.
Yeah.
So it's just, but that was so amazing. And she's been good since then, which is like over 2.5 years ago.
Well, so tell me this. Yeah. Is this something that needs to be done consistently?
Some animals do. With this Pleckner syndrome, we have the whole range. So I have a client who, with a dog that spent over $40,000 in 3 different hospitals for irritable bowel.
Oh my God.
She is, and it's a little Havanese. And what works for this dog, we tried with just 1 or 2 dosages of it, and it would be okay. But what she found is, because we make capsules, she gives 1 capsule a day with her other supportive stuff that we do for Pleckner, and the dog is fine. She said it's the cheapest thing. The insurance covers it. The cheapest thing she's ever done in her whole life is just give the cat 1 capsule of poop. And she, buys like 90 capsules at a time. And she has them in the freezer, and she keeps them frozen, and she just pops. And she said it's the most inexpensive. So that's the most extreme, of a client that has to have it every day. And then some of these animals, 1 treatment is all they need. They get 1 treatment, they sail off. Some, the owners can tell when they're starting to decline, and they just pop an oral capsule in, and it takes them back up. Some animals, when they decline, they can't always absorb it through the oral. So we have to do the rectal, insufflation of ozone, and then a slurry of the cat microbiome. And so we're now selling it to veterinarians all over the country. So if you're a veterinarian, if you want to look into this, our website should be, it's there, but it was like 66 on Google because we had an older website, but it's microbiomerestorativetherapy.com. And I don't know, it's supposed to go live. I was hoping to get it live by today. I mean, it's live, but it's not easy to find it.
Okay. Well, real quick, Lindsay, if you could pin that it's microbiome restorative.
You do HTTP, that you do that, the whole URL.
Restorative.therapy.com. If you could pin that here, Lindsay, in the comments, then everybody will have the access to it. And more people that click on it, the further it'll go up on Google anyway.
Yeah, that would be great. So it's if you do the HTTP, that whole microbiome restorative therapy.com. And we have another one that you can get to it, which is, we thought it was fun. This was like 8 years ago, and I did. It's eat shit and live, but it's SH-T and
Eat shit and live.
Oh my God.
I love that.
That's so it's easy to remember, but I don't know where it is because we're rebuilding the site. And the hope is to do, we've been doing a survey with our clients on the behavioral changes from the microbiome. So we're trying to I have a paper already written, but now I have some stats we can add to the paper. And so we're having a lot of new research articles that are on there. And I have 2 pre-vet students that are helping me and do that.
Oh, cool. Good. So if anybody wants to know how, wants to contact you or wants to know how they could get their vet to work.
Yeah, they can go to my clinic website, which is mashvet.com, and it'll link to the microbiome, and then it'll link to that website too, which is, long. It's a long thing, that's why I thought the SH-T, and live was funnier and easier to remember.
It is fun.
But I did visit MashVet, and I think that's just also a great resource for people to look up and just get more context about you and your background and what you do and your passion for this. I think it's mind blowing.
I think it is too. So let's jump into some questions so that because we're already like an hour in.
I know, but we could do this all day long.
I know we could, everybody knows we can talk forever, but when we're talking to somebody with so much knowledge, we could literally stay here all night.
Oh, so many questions. Sally, I know you asked your question a long time ago, but this one, I want to do this because I know we got more to catch up on. Sally said, I've heard that the fecal transplant can also somehow import the healthy, calm demeanor/personality of the donor animal to the recipient animal. Have you seen this happen? And thanks. So I think.
Absolutely. I have another, I can tell you stories. That's why you want to hear stories about that?
We love
Let's do another story.
It's
Yeah,
a
here's the
dog
best.
story. It's a dog story, but trying to remember all my cat stories. But this is a dog. Her name is oh gosh, I can't believe it. Kaylee. So Kaylee is a beagle, and Kaylee was owned is owned by a person who does pet therapy for elderly. So she's been this. She got her from a shelter, and she was this very, very insecure, very clingy kind of beagle. Never ran away, never dug a hole, never would go near water, just clung to the person. She was hiking in the woods, and for about 15 minutes, she ran off, came back screaming in pain. They took her to her emergency, the hospital they go to, and they said, your dog has cancer in its leg and its abdomen. And so they took it to an oncologist, and they diagnosed hemangiosarcoma in the abdomen without, they didn't have a positive biopsy, but they were 100% sure it was hemangiosarcoma, and they couldn't control the pain in the leg. They had her on two different narcotics and two different antibiotics. They couldn't control the swelling in the leg and the abdomen, and they said, she's got cancer, she's dying, you need to put her to sleep. So they were ready to put her to sleep, and Shirley Moore, who we've written a book together, it's called Healer in Every Home. This is it here. This is it, Healer in Every Home. So yeah, so we
A healer in every home.
yeah, and I think that is that Stella. That might be Stella as a kitten. I think that's Stella as a kitten. Anyway, a healer in every home, and so the Shirley Moore, she said, "Oh, have you gone to MASH?" And so she said, "No, I've never heard of them." So we went there, and the dog came in. Dog couldn't walk. His leg was all swollen. His belly was all swollen. And I said, I don't know what's wrong with the dog, but it sure doesn't sound like it got cancer in 15 minutes for running away. Maybe it got hit by a car and it's got a big, huge, bloody, hematoma in the abdomen and the legs bruised, and there's no positive biopsy. I'm not personally convinced it's got cancer until I know it has cancer. So anyway, I said, let me just try all the things that we do. So we did the ozone, we did ultraviolet light therapy, we injected ozonated saline into the leg. We did the fecal transplant because the dog was on 2 weeks of antibiotics. So I figured everything was killed off, right? So we did all the things that I do to help build the immune system. In 3 days, the dog was normal.
Wow.
3 days, the belly went down, the leg went down, the dog was running. But this is the part that's wonderful, okay? But the part that blew me away is this dog who would never go near water, never dug a hole, never went anywhere besides next to the owner, was running away, digging holes and jumping in the lake and smiling. Never smiled. Now my dog smiles. So it was smiling like my dog smiles. Now
Wow.
that's crazy to me. That is kooky.
It is.
Never smiled. And the fact, so it's now over 3 years now that this happened to her. The oncologist wouldn't talk to me. Nobody would talk to me about this case because I don't know if it had hemangiosarcoma, but I don't think I cured hemangiosarcoma. Maybe
Right.
I did, but I don't, I still don't know what's wrong with the dog or what was wrong with the dog. So, but anyway, this dog is still alive when it was told by two vets that there was nothing else they could do but euthanize this dog. So, but Kaylee's still around. So she does pet therapy still with her. And now she comes in and it was just funny. We were talking last year and she said, she comes back, she's covered with mud, she's covered with everything. I have to wash her up before I can take her to work. I said, well, which dog do you like better? The one before or the one? She said, no, I like the one now. She's much happier. But what beagle doesn't go dig a hole and spend its whole life burrowing down it to have a beagle so I think it restored her olfactory, neurons.
Resettings.
Yeah.
That whole nose because what beagle can't smell? I mean,
Wow.
This dog never could smell. So it was, we know from the adoption that she had some kind of an injury. So she probably was put on antibiotics and maybe had an abdominal injury. Nobody knew what was wrong with her. We still don't really know what's wrong with her. So, but what was wrong with her? But in any case, the olfactory came back. The dog is pretty much, there's a few things that we're still questioning what's going on, but I still don't know what's going on, why this dog did what it did.
Wow.
But you keep digging like a
Yeah.
beagle.
I bet, she's digging and jumping in the lake and getting all wet. She wouldn't even go near a puddle. She'd have to if it was a puddle, she'd have to drag her around. She was like this.
Oh my God.
Wow.
Okay.
Wow. Okay.
My God.
Lindsay has a question. Lindsay says,
Can this treatment help my kitties with their asthma and their autoimmune problems, both digestive and labored breathing due to environmental allergies?
My hope is yes. Ozone we know helps with asthma and allergies. But the microbiome, just as we're talking about this whole stuff, how do you balance the cat? If the cat has been on antibiotics at some point, and if it was on antibiotics, it wasn't on antibiotics, but its mother was on antibiotics, it never got what it got from its mother, because the first vaginal gulp that happens that spreads the microbiome comes from the mother and comes from them going through the vaginal canal, the mother licking the baby, nursing the baby, doing all the things that, a normal mother would do. So, if you never got that, and your grandmother never got that, and your great-great-grandmother never gave it to you, and your great-great-grandmother was on antibiotics, what in the hell did you get?
yeah.
Very little.
The
And you
genetic.
talk about that in cats, because literally you can have one every 6 months, a generation. So how many generations have been tainted by the overuse of antibiotics and medications and lawn fertilizers and chlorine in the water and fluoride in the water and drugs?
Yeah. That's interesting. Okay. Jenna said, will it help with cats in renal failure?
Yes, I've had cats that have gone completely out of renal failure from ozone and fecal transplant.
What?
Really?
Completely. I mean, this cat was 14 creatinine, 13 creatinine, was normal afterwards. And she went back up. We did another one. It went back down. And they decided not to keep doing it with her. But I think because we have a product called Azadil, which is a probiotic that we use in dogs a lot for, what they feel is by giving this particular probiotic, you're helping with the creatinine, bringing the kidney function down. So by giving them one probiotic or giving them healthy microbiome from a cat not in kidney failure, it makes sense to give them a healthy microbiome, a cat not in kidney failure, right?
Wow. Yeah.
So I think ozone is amazing for kidney failure. I had one cat who, I should talk about her. Yeah, Blossom was wonderful. Blossom came to me at 17 years old in kidney failure. And, not terrible kidney failure, like creatinine of 4, something like that, not craziness, right? But in kidney failure. And so I told the owner to get an ozone generator, learn how to make ozonated saline, give the cat ozonated saline, and we're doing lactated ringers, and we did acupuncture for the kidney failure. We put them on kidney herbs, that Chinese herbs and Western herbs, and some nutraceuticals that we use for kidney, and not on KD diet, not on any of these diets and stuff. We put it on a healthy diet, and I ended up having to put her down at 24 years old.
Oh, wow.
24.
17 to 20. So she had 7 more years and lived 7 more years. And I give total credit to this client who was dedicated to taking care of her cats. But she was given her ozone and doing all that stuff. So I don't know what component did it, but most cats don't live to 24. 17, you get to a cat with 17 and kidney failure, you're pretty much, well, that's it, right?
Right?
Yeah. A lot of people.
Right?
Yeah.
That's incredibly exciting.
She's my inspiration, so Blossom is, anytime I have an older cat comes in kidney failure, I think, well, look what I got from Blossom. Blossom did it. Let's try, right? Let's try what Blossom did.
Well, given that this is kind of a common issue, what do you recommend for those of us that, only have a conventional veterinarian? How do we ask about?
Educate them. They can go to my website. I teach the ozone certification course. I'll be lecturing this in 2021 if we have conferences at the Western Veterinary Conference, which is a really big conference in Las Vegas. And I'll also be lecturing, if we have a lecture, at the Chi Institute in November and teaching a 16-hour ozone certification course. So ozone is just, I feel like, I get so excited about it because I see things that normally, you sort of feel like, and then it just gives you more time to get things, bring down the inflammation, bring down the infection, kill viruses that we have nothing now, right? We're in the middle of an epidemic and everybody's standing there staring at the wall with dexamethasone and one antiviral drug that increases your chance of survival by 3%. That is not a good thing.
Right. Right.
Right. So we need people to be open and thoughtful and tap on the shoulders of scientists that are using these modalities around the world successfully. We have to. We don't have all the answers in our famous hospitals in Boston or our famous hospitals in New York. They don't know this stuff. And we have to be looking at it because we as animal lovers and as veterinarians, we have to take care of our animals. But I'm trying to show these veterinarians and these physicians, if it worked for corona in cats, let's think about it.
Yeah.
What's the perfect time?
What exactly? Why are we so? You have to have a drug. You have to have the FDA. You have to have this, and you have to have this, or don't say anything. And I want all these doctors to say, my patients are dying. What can I try? Come on, guys. You've got other countries doing it. You've got, they're doing trials in India, and Cuba has started a trial with Ozone for COVID. Spain has already done it. Spain, Italy, they had it in 18 hospitals and were successfully turning people around. But we can't get our doctors to turn their heads.
Yeah.
So I ask I can't, please ask your doctors to look at this.
Well, I think this is really.
Have someone who is a really compassionate, caring veterinarian. Ask them. Why don't you look at this stuff? Well, I don't believe in that integrative stuff. Sorry, you're missing opportunities to help.
Well, and you're missing the chance to give more time and more quality of life to these beautiful little souls that we're guardians of.
Yeah.
I mean, I think that this is a really empowering thing for all of us to hear and really absorb, though.
Especially
is that it's okay to ask questions. I mean, I think whether
always ask questions. I mean, it's harder now to ask questions because now with COVID, we're outside the building and we're not coming in and everything. But and you don't want veterinarians to feel threatened that you're trying to challenge their intelligence. What you're trying to do is collaborate. We're a team here. I'm part of the team. This is my cat. I want the best for this cat, right? And if you don't know this stuff, don't feel that it's a problem that you don't know it, because a lot of people don't know it. But open your mind, say, I want to do some reading about it, and not just read one article that discounts it from somebody who's a skeptic, the skeptic vet writers who, condemn, acupuncture and chiropractic and all the things that have been helping so many animals and humans for so long. But to really ask questions, go to websites, read the science. Don't just ignore it because you don't read one article and this guy says, oh, it's hooey wooey, Well, you know what? Maybe it's hooey wooey, but if it works, I'm okay with it.
Yeah, exactly.
Hooey wooey. But poop was shit, I mean, and I see, the best that I can get out of that is what I'm trying to do, is to use the microbiome to help me help the cat.
Yeah, absolutely.
Well, and here's another question. Joan asked, I would love more information on natural resources for thyroid disorders. My cat Sammy has thyroid issues.
So hyperthyroid.
Hyperthyroid? Okay.
Probably.
There are herbs that you can use. There's this veterinarian in North Carolina, and she's had really good results. I have not, but in her hands, she's had very good results getting cats off of thyroid medication. I think her name is Brown, and she's in North Carolina. But if you go to the American Holistic Veterinary Medical Association and look for a holistic vet, there are herbs that help reduce the amount of tapazole that you can use. There are ways like that you could do it. I have not, in my hands, been really successful in getting cats off of thyroid medication. So I have to admit, I tried some of her ideas, but she was much better at doing that. So that's one area that I don't see as many hyperthyroid cats now. I really am not, for some reason, I'm not seeing those numbers. I'm seeing the hypothyroid cats now.
Oh,
so
wow.
That's crazy.
That is.
I never saw, I think the first time I saw a hypothyroid cat was about 20 years ago. And I was like, oh my God, never seen a hypothyroid cat. Hyperthyroid, it was like, anything over 15 years old, you suspect as hypothyroid. But now checking the thyroid, because your thyroid is your most vulnerable organ in your body. So I'm wondering whether cats were responding by being hyperthyroid and dogs were responding by being hypothyroid. And now the cats are getting so sick, they're getting hypothyroid too.
What do you know about the radioactive iodine therapy for hyperthyroidism?
Well, I've never been a proponent of radiation, but I've had one cat that seemed to do well with it. I had one cat that really got sick from it. And I first try other things before because I think radiation is not something I want to put anyone through. And the other component that really bothers me is when these cats they're kept in the hospital and they collect the urine and the fecal for a short amount of time. But it's a short amount of time. That radiation's still in parts of the body that's coming out, and you're handling it, and it's in your house or in your, it bothers me about Radio Cat, but there are people that are very successful in doing it, and you talk to your veterinarian and discuss the pros and cons of doing that. But I've always felt really insecure about kind of radiating my cat.
Yeah.
Oh, we could do this all afternoon, but we've got many more questions.
Yeah. So So Jody said, not sure if this is allergy related, but my pure white cat is a raw fed cat and also gets a tiny few pieces of good quality dry, 20 pieces per day. I do that to ensure a few extra nutrients, but is 96% is raw, made up of daily chicken wings or neck, raw kangaroo. She's in Australia. With chicken heart, liver, pureed vegetables. Sometimes very randomly, she has a slight yellow tinge to her coat in the summer. And I wonder if this is stress or diet or nothing at all.
I don't know. I mean, because white cats can turn just from their saliva, licking themselves will cause themselves to turn yellow. So if it's on her normally where she is washing her paws and, doing this kind of thing, then you could see the yellow wherever she's licked herself. But the saliva could have certain things in it that would stain the hair. So that would be my first piece that I would have. And it's possible that licking and then laying in the sun, that is like a slight bleach of stuff, that could be causing
Yeah,
that could be.
That's interesting.
Is that also why, we had our Mr. Biddles with a little gray kitty, and he would get like a copper tinge to his mane.
But possibly it could be licking, and we don't know what other residues are in food. I mean, even her kangaroo, but kangaroo is supposed to be wild, but they're not. They're farmed, but are they fed, food that is full of chemicals? I mean, in the United States, all of our farm animals that are used for animal food are fed glyphosated feed. So it's filled with Roundup. Where does it go? It goes into the meat, goes into their body parts.
Yeah.
Oh, okay. We got to do another question, but I've got to read this comment. This is from Teresa. She said, I just want to say thank you to Dr. Roman. You were so kind to me when I emailed a few months ago looking for an ozone vet recommendation in my area. My cat Paco has been getting various ozone treatments for his mast cell tumor since then and is doing really well.
Oh, wonderful.
So, shout out to your awesome work that you do. Okay. Next question.
Globetrotting Girl on Instagram said, what do you think about the 5 strands at-home allergy testing for cats?
5 strands. I'm not familiar with that.
I'm not either.
Okay. I wonder if that was a type of something.
Doing allergy testing and figuring out if there's a HESCA test, and then there's Jean Dodds test, which is the saliva test. Having that information is great to have that information, but to me, it's like, why are they allergic to? Let's redo the microbiome and then see if they're still allergic.
Yeah, that's always the issue with allergies, right? I mean, it's a constant treatment of symptoms rather than getting to the root of the problem. And when I was in dog nutrition for 10 years, we would see these itchy skin cases, right? And they were always diagnosed as allergies, and 95% of them was an imbalance in the gut, usually a yeast overgrowth. And by getting that gut back in shape, then all of a sudden they don't have allergies anymore. They're not allergic to their owners. They're not allergic to the grass and the trees and, all the stuff that would come back in those allergy tests.
Right. So it really, as we know more about the microbiome, and we don't know hardly anything. I mean, the tests that we have, Animal Biome does a wonderful test. It's called the 16S test, and they do a beautiful job at it and give you a whole detailed, this is their microbiome thing, but they give a whole list of what your dog or cat has and how it relates to normal cats. And it's 16 species, and there's 500 and 1,000 subspecies. So theirs is the state of the art of doing that, but the state of the art is like a baby, like a teeny.
Still so much to learn. Yeah.
Yeah.
And the more I read articles, the more I think, oh wow, I know less than I did after reading this article. I know less.
So exciting.
It's good too, though, right? Like you never want to
learn.
stop learning, because then you might as well just, fall over and die anyway. Because why, so that's the learning
a little
is
dramatic.
Well, that's what I always say about me. But actually, real quick, I want to ask, because we're talking about this. I know this is probably a question. Is there any, and I know the answer, but is there any risk of like a side effect, or is there any, and since we don't know exactly how, what strains and all of that we need in the microbiome in the gut, by doing a fecal transplant, are there any, could there ever be a side effect or something that might harm?
Could be, but we don't know. I mean, we're hoping that, knock on wood, we haven't really had any negatives coming from ours. I mean, the negative would be that they get into the carrier and then they poop it out before they get home. That's negative, right? Kind of thing. So because I want them to keep it in there, and that's negative. So we really haven't had negative. In humans, they had one death due to a fecal transplant, and the woman was put on antibiotics, and she developed, the fecal had resistant strains to the antibiotics that she was on, and she was very, very immune compromised, and she died. So they had one death. So of course, if you put it up there, they've done thousands of them around the world now. I mean, thousands and thousands now since I started in 2012, and it all really broke open about 2016. And so they've done thousands. So this person just recently was a death. And I really, the person who wrote the article, I confronted her years ago about using ozone instead of using antibiotics. In humans, they use metronidazole and vancomycin to kill the overgrowth of bacteria, and then they give a fecal transplant for Clostridium difficile, which is the only thing that we are allowed to do by the FDA. The FDA has only given the approval for C. diff. And I can get into a human story on that if you want to. It's amazing, amazing, amazing story. That maybe, should we go on or not?
We want to get everybody's questions answered, but we're going to have you back, because there is still so much more to talk about, and we've got so many people here.
Right. Pam Roussel, who herself is an awesome holistic tool in our kitty cat care toolkit. She said, would fecal transplants help with feline diabetes?
I think it can, because we have all this relationship between the gut and the pancreas and the digestion of the food. They know that certain fecal material or probiotics that they're trying to isolate help control weight. So, Mass General is even doing that now, where they give a fecal transplant to an obese person and they lose weight. I've been doing that on animals. I did it with a cat who was obese, and we gave a fecal transplant and he lost a bunch of weight. So if your microbiome is what breaks down your food and helps you break down food, and it's not complete, then how do you break down food properly, right? So you're not, right? So by giving them, so when we use antibiotics in veterinary medicine in farms, they use them to fatten up the cattle. They put them on antibiotics to fatten them up. And so it's now, sort of mostly outlawed, but it's still allowed to use antibiotics to fatten up the cattle. And so the reason it probably works is it makes them so dysbiotic, meaning they don't have all the species, that they start packing on pounds. Think about how much obesity we have in our country, and how many children have been on antibiotics for the littlest ear infection, or for a cold that was probably viral, or a sinus infection, which was probably viral. And then they have issues with obesity. So it's, we have to look at that as a component to how to rebalance yourself.
Wow.
It's like opening a can of worms. Like you really start going, like when you really start thinking about this, all the ways that it could be implemented. Kim said, I recently purchased and started using Ion Gut Health from
Great.
Dr. Zach Bush,
Which is wonderful.
but haven't given any to my cats yet. Can I share it with them, and how?
Yes. So 6 years ago, I met Zach and we're friends. And I was the first veterinary clinic to start using the Restore product, which was called Restore. And so I was really excited because what it is, it's a combination of humic and fulmic acid. And he basically derived it from ancient peat moss. And what it's doing is it's sort of mending the leaky gut and allowing the microbes to talk to each other and start to allow new microbes to come into the system. So we always include that with our fecal transplants. So we're using that as an oral, amount. If I can do it 1 or 2 days before, I do it. If not, we do it all at the same time, and then keep them on the gut ion and keep them taking that so that it's allowing those microbes to keep talking to each other. And I also like to use colostrum too as well, because colostrum is the first milk from the mother. And they couldn't understand that there was a particular sugar in mother's milk that the baby cannot digest. And it was stumping everybody for a long time. And they realized it's not to feed the baby, it's to feed the microbes. So I always include there's things that's why we call it microbiome restorative therapy. We're trying just not to throw poop at them and say, you deal with it. We are using components that allows the microbiome to diversify, to become assimilated and meshed up in a symbiosis with these other species, because we're nurturing both parts.
I love the throwing poop.
Yeah,
I have so many pictures in my head
every
when
time
we
I
talk
just
about
think of
throwing
monkeys.
poop. Yeah,
Hey,
monkeys.
Peter the poop man right here just asked.
Oh, Peter, okay.
Here he is. It's a poop-tastic question. Stand by. He said, people that are allergic to cats, is it the person's gut that's leaky, or is it the processed diet the cat is eating, or a combo of both maybe?
It's a great question, Peter. I don't know. So, people that are allergic to cats, maybe they are missing some of the diversity in their body as well. And right. And people always said it was the cat saliva that everybody was allergic to. And right. Possible that the cat saliva is missing out on a lot of the bacteria that's normally there that doesn't make it so sensitizing to people. These are just great questions. And so the more you extrapolate, so what we are doing now with the oral microbiome is I'm taking my dogs, my dogs for 27 years, 5 generations, I have never had on my cats or dogs one piece of plaque or one piece of tartar. Not one tooth fractured, not one missing tooth, no gingivitis for 27 years. Now, what is that about? So we're now, my feeling is the biofilm in my dog's mouth, because they don't get any chemicals. They don't get fluoride. They don't get chlorine. They don't get pesticides. We're not killing their mouth as licking the front line off their body. That's killing their microbiome in their mouth and causing their teeth to decay. So we're now selling the biofilm of my dog's water bowl. So every 3 days I mix it up and pour off the water and store it, and the clients are coming in and buying my water bowl water. Now, isn't that
that is so interesting?
That's yeah. Woo woo. What'd you call it? What did you call it earlier?
Woo woo woo.
Wooey wooey.
Wooey wooey. No, but it makes sense though, doesn't it? That if you don't have the proper biofilm, that's what produces your plaque. And then you get the plaque and you get the tartar, and then it builds it up and it recedes, the gums recede, and then you start losing your teeth.
Yeah.
And if there's a very good documentary called Interconnected, and it's a series, and they had the oral microbiome, and it's wonderful. It's the Interconnected is like a 9-part series. I think the oral microbiome one is, I think similarly, but it's really well done, and people can watch that. And once you start watching some of these documentaries that are really giving you the scientist and the science behind it, you start, thinking about these questions, like, what if I do this and I do this and I get my gut healthier? Will my, immune system shift, and will I not have cancer anymore? So all of my cancer cases get fecal transplant. All of them do. That's what, and interestingly, I lectured at a huge human microbiome conference 5 years ago at Target Discovery. And the only thing that they were talking about was Clostridium difficile. So Clostridium difficile is the overgrowth of bacteria in the gut, which is one fecal transplant is 97% effective. But it's so effective that the government won't let you have one unless you've had 3 hospitalizations for C. diff.
Oh my God.
You can't get it legally from Medicare or anywhere unless you've been hospitalized 3 times. And this is 97% effective. So I can give you, that's the whole story that is really fascinating. But the whole point is when I gave this lecture and I literally told them, C. diff, and I've had dogs with C. diff and C. perfringens that they couldn't get rid of. One fecal transplant, gone, just gone. After 3 years of metronidazole, they couldn't get rid of it. And so just one fecal transplant, gone, right? So I literally, the first ones I did when we were being crude was I literally brought my dog in, Lily, and I had the recipient here, and I took my finger in her tush and I put it in the dog's mouth, like one arch moment to do it. That's how I did them until Lily wouldn't come with me anymore to work because she was like, what are you doing?
You're going to touch my butthole.
I'm not going to go with you anymore. So, and then I tried that with Trapper, forget it. He was like almost bit me, my cat. He said, you're not, so I have to collect it from the litter box. I'm not going to ever do that to him again. So that was one time and not anymore. So anyway, but I talked to these doctors and I said, you're talking about C. diff. That's literally slam and dunk, right? It's so easy to do that for C. diff. We're treating all of our cancers, all of our autoimmune disease, our pancreatitis, our kidney disease, our behavior. I said, but to treat and they looked at me like I was nuts, right? So I lectured again about 4 years later at the same meeting. They had a whole track on treating that cancer with microbiome.
Wow.
They're like, yeah, this kind of makes sense.
Right. So the research is there and we just have to let, these dogs are eating poop anyway, right? We're just directing them to eat the right ones.
Yeah.
They've been self-medicating since I've ever been a vet, and forever,
Yeah.
So we're trying to direct them.
Super fascinated by this whole dental thing. One of my really good friends is a vet tech, conventional vet tech. And she said dental issues with cats are literally the bane of their existence. It's such an intricate thing. Everyone thinks, oh, well, just normal. At some point, they're going to have extractions, but you have to make sure that everything goes right because we've got, but just thinking about going on the rabbit hole.
I went to a lecture at North American Veterinary Conference, or no, Midwest. And I was lecturing there and I went over to the dental lecture and I raised my hand. I talked about this and they didn't get it. The dentist that was lecturing and telling you, about absorption lesions and how you have to take the tooth out and all this stuff. And I raised my hand. I said, well, have you ever thought of reintroducing the microbiome of the mouth? No, we have to take these teeth out. I said, have you ever thought of like not going there, right? And getting something? I think they're getting it a little bit, but because you have to keep saying something to them. Like it makes not to have tartar on your dog's teeth for 27 years. And I'll tell you, my daughter has one of my puppies and he's lived here till he was 4. And then he left when the puppies were born because it was her dog. And he's in San Francisco. He's drinking water from her faucet. He goes to the beach. It's so filthy on that beach where she goes. It's like covered with brown foam. He runs on that, picks up sticks from that water, and she's not feeding him what I feed my dogs. And I couldn't believe his mouth. I went out there in November. I could not believe how much tartar he had in his mouth. And his teeth were perfect when he left. And like within a year, his teeth were like he never had anything done to him. So it is all this contamination that we're killing the microbiome of the mouth when we give our cat food. Cat food is full of glyphosate. They're eating something that kills their bacteria in their mouth.
Yeah, well, and the vets not all the vets, obviously, but many conventional vets will recommend feeding your cat kibble because kibble is good for the teeth of your cats. But we know that kibble is so high in carbohydrates that the
problem is the kibble is so highly processed.
Yes.
And you want them to chew, and some cats will crunch and chew. But if the kibble has got no microbiome in it and is not feeding the microbiome of the mouth, because it's lacking so much of the natural kinds of things that cats eat.
Right.
How can you feed that microbiome? You're not feeding that microbiome, and they need to feed that to make the mouth healthy.
Yeah. And sugar isn't the best.
Okay,
For
we're
Peter has,
quickly
like-
running out of time.
Yeah. So,
And then
oh, Teresa said I gave my cats hydrogen infused water. What's the best pH to give them?
That's interesting. So hydrogen diffused water, yeah, that's a big thing now. Quicksilver makes the tablets. I haven't really used it. I have it in the cabinet. I haven't used it that much, but it's similar to ozone in that it changes the quality of the water. But keep trying. Let me know what you do. I'll have her.
Yeah. I was doing a bunch of research and it looked like, reverse osmosis and hydrogen infused water seemed to be like the best for our
Yeah,
cats.
I mean hydrogen infused. I like I said, I was going to experiment with it, but it's still sitting in my.
yeah,
And we'll come back for another one.
Kenley wants to know if you sell your water bowl water online.
I don't think I make enough of it, but they could. What I would do if they want to. I mean, if we have some, they could probably try to get it. What I do right now is I really work with vet. So my hope is that we educate these vets, and then they become, more open to like, why not? And there may be other cats and animals in their own practice that are really similar to me, have been protected from over vaccination and from pesticides and from all these chemicals and everything else, that are really healthy. And maybe they would be someone to utilize to help the other patients in their practice. But what I love to do is to get a veterinarian on board, get them educated and make them like realize, oh my God, I have, but doing ozone in the mouth, getting ozonated oils, which you can buy over the counter, at Promo Life and O3 Vets and Longevity, they all sell it over. They don't have to go to a vet or a doctor to get it, but you can put that on the gums. Making ozonated water and flushing the mouth with ozonated water. So my mother's 91 years old, and of course I bought an ozone machine about 7 years ago. And before COVID hit, I said, Mom, you've got to be doing this every day. You've got to be. So she drinks it. She used to do it once a week and put it in her water pick once a week. And that's what she's been doing for the last 7 years. So when COVID hit in January, she started doing it every day and putting it in her water pick every single day. And before she was put into isolation in March, so 2 months of doing that, she went to the dentist, and the hygienist said, in my career, I have never seen somebody 91 years old with perfect gums. What do you do? She said,
Wow.
All over this.
Yes.
and so it gets rid of the biofilm and then floods it with oxygen. What is bad with that? People are using alcohol in these mouth rinses, killing off the microbiome to the point where leaving a toxic residue with the chemicals and the dyes in there, trying to get rid of so she's just using water, ozonated water, and cleaning her gums. And then she said she was shocked. The woman was so my mother filmed herself. I said, Mom, you gotta like do a little video of yourself doing it. But she was so enthusiastic. She almost sounded like the guy from My Pillow. It's like, I have, I was laughing so hard because she was like, my gums are so, and they are, I mean, for 91 years old, she's got, woman couldn't believe that. She had no recessed area because it helps the gum come back again because you're flooding it with oxygen.
See, that's very interesting because we get so many cases that people that come to us with cats that have stomatitis, and I feel like just hearing what you're saying thus far, if we did ozone and fecal, because you said this helps with
right. And I had a cat that had stomatitis really bad that I only got to treat. It was really early in my ozone treatment of doing it, and we started. I mean, I've never seen anything. It was also a Maine Coon cat. Wow. It was it almost looked like fur. It looked like, it was like almost the color of your couch, but like a fur over the whole gums. And I tried with ozone. They tried it for about 2 weeks and we didn't see any, they didn't stick to it. But, after the fact, I wasn't doing fecal transplants. I wasn't doing some of the stuff that I would have really loved for them to have stuck with it. But it was better. The inflammation was less inflamed. But I didn't, that was always one that I wish I had more information. I knew more then than I knew then, whatever, I know more now.
Yeah.
Yeah, but for the people that have the bad teeth, to talk about that with their veterinarian, talk about the oral microbiome, watch those videos from Interconnected so that you come in with science and education to them so they can't go, well, that's just, wooey, wooey, kind of whatever. The science is there, guys. The science is there. So don't keep throwing it off and saying, well, we need science, because that's always the excuse of the conventional vet. Well, show us your double placebo blinded studies first.
Right.
They don't have double placebo blinded studies for most of the stuff that we do in veterinary medicine, but we have to prove it with double placebo blinded studies for them to validate something that's done differently.
Wow.
Okay, can I put you on the spot? I know we've got to wrap up soon, but can I put you on the spot and ask if you would do us the great honor and our audience here today of coming to do another interview with us sometime in the near future?
Sure.
There's so many new questions. I mean, I know that there's a couple that we probably missed. Peter, we definitely missed a couple
we missed
of yours.
Peter had a lot.
We should cover those on Peter's questions, but but there's, the more you think about this stuff, it's like, oh my God.
It's mind blowing.
And the same thing with ozone. Why not use that, why do you need antibiotics to kill all the microbiome? Let's just start with ozone. Don't start with antibiotics.
Right.
Don't start having the cascade downward. Open your eyes and look at something before you start throwing drugs at it that you don't even know if they're gonna even have an effect on that bacterial infection. You don't have a constant sensitivity back, so don't start on it yet. Right.
I think I speak for everyone here when I say this is probably one of the most refreshing
and informative,
illuminating, educational conversations, and I just want so much more of it. I just think this is definitely like the tip of the iceberg in so many ways, and I know that we're definitely going to be getting a lot of follow-up questions as well. So
and we'll save them, and then
we'll
I'll contact you. I'll email you and be like, okay, let's do it again. When are you available? And then we'll set this up again. There is so many people here joining us today, and so I know everybody is really excited.
I'm working with you guys. You're really enthusiastic, and we're all trying to help these. We love them. I mean, I'm surprised they haven't jumped up here. But we love our animals, and we just don't want, we don't want them to suffer. We want them to be healthy. We don't, to have them live to 24 years old would be my goal for every cat, right? And they don't, and why can't we set them up to be surviving a longer time? Like, how do we, and that's one thing that Peter and I are talking about, is getting the microbiome from animals that are living into their 20s.
Like Jake Perry's cats.
Jake Perry, He has like the oldest living cat is I think was 38 years old, and it's our goal now to make like our kittens, or the ones that we're actually being able to raise.
What I want to ask your viewers, figure out who has the oldest cat, who knows the oldest cat, who knows when they were born, who knows their backstory. Let's get their microbiome and let's mix it with trappers. So it's what we do. We're doing right now with Peter's, we're doing that. Microbiome mixology, which is a term I coined also, is taking an older dog, like I took my dog Geneva, who had cancer for 7.5 years, mixed it with her grandson, and was using it for my cancer cases. So somehow she navigated cancer for 7.5 years and was still riding with horses, and for cancer that should have killed her in 6 months. So what is enabling her to live that long? So what we're asking your viewers, if they have a 24-year-old cat, let's harvest that poop, and it doesn't, there's no work on the cat except yoing a litter box, and let's mesh it together and give it to some of these cats that have cancer, that have issues, that we can navigate them and try to help them maybe live longer and more vital by mixing microbes.
I love that
so much.
That sounds awesome.
You are
amazing, beautiful.
I'm just so grateful for your time, for your experience, for everything that you've shared with us here today. And I'm very excited for the opportunity that we can talk to you again sometime. This is, they're just so many. These are the big topics though, right? Yeah. These things that our kitties deal with, and we want to know everything that we can. And sometimes it's difficult, especially with conventionary medicine, to feel empowered to ask those questions, to
Yeah.
even know what
If
to
there
ask
is,
for.
yeah,
So
to even know if there is a, you know, like you said at the beginning, there's so many vets that they just throw up their hands and say, no, you just need to put them down. And we hear that all the time in our
it's
industry.
heartbreaking.
And a lot of conventional vets, especially, they don't, you know, they don't see as many cats as they do dogs. And so a lot of conventional vets, you know, don't necessarily even know how much they're, or what they can do with people's cats. And to be able to have like some answers and not give up, and to see that maybe there are other things that we can do for our kids.
My suggestion is to go to the American Holistic Veterinary Medical Association website, to the Chi Institute's website, to the homeopathy's website, and find practitioners in your area that have stepped out of the standard of care paradigm and are willing to look at other things. And, you know, and hopefully those individuals haven't closed off their mind, say, well, I only do it this way with homeopathy, or I only do it this way with acupuncture, and I don't look at this whole thing. There's so much we don't know, and everybody's got to share and collaborate. And we've got to do the same thing right now in this pandemic. We have to share and collaborate because we don't have all the answers.
Yeah, absolutely. So if you guys are looking for that website, you can go to ahvma.org, and it'll have a find a vet there, and you can put in where your state, your city, or your state is what I would put in, and find all the holistic veterinarians that are near you that you can collaborate with.
Absolutely. And then what I would love to be able to do is then collaborate with them. So if you can get to a holistic vet, the language is easier. It's like we are speaking similar words. If I go to a conventional vet and you have someone who is broad-minded and excited to learn more, I am happy to try to, you know, consult to them and work with them and try to get them to be the eyes on the ground. And then hopefully they learn something and go, you know what, I think I want to do this to another cat. I have another cat with irritable bowel that I've been working on that I can't control. Let's try this. And it's really fun to see them reordering more poop for the next cat. You know, because they want to have it in the building, or the next dog, and they want to have it so that they've got it. They don't have to think, oh, you know, it, because in my clinic, pretty much most of my clients that come in with chronic problems for the first time are going out with microbiome support, because if I can start with 80% of the immune system cheering me on, then why don't I start there before I start doing anything else? Let's just start with baseline.
Yeah, absolutely.
I'm so excited for the trickle-down effect too that this is going to have on thinking about our own health and the ways that we care for our bodies and our pets and everything in general. I want to say, I'm just going to echo, I know that you can't see the comments, but here on the Facebook Live, there's just a lot of gratitude. Thank you so much for all the info today. So grateful for the time to be with us today.
Yes.
Thank you, Doctor. So I just want to echo their gratitude.
And I
and thank you
makeup
again.
on, and I was out hiking with my dogs before I came in here.
You are
very lucky to be living in the woods, and I all of you that are cooped up with COVID, you know, isolation, you know, just try to stay as healthy as you can. I can't give advice as a veterinarian, but your animals, you know, can stay healthier by, you know, eating fresher things and getting into fresh air and stuff like that, because we really need to do that.
Absolutely. Absolutely.
Dr.
Thank
Roman,
you
thank
so
you so
much
much
for joining us. And we will be in touch for
To
our next
schedule another
interview. Yeah,
follow-up.
to schedule a follow-up interview as well.
Okay, great.
In the meantime, give Trapper and Bliss head boops to from us.
Yes.
Well, I don't know where they are. They not even in this room. I think I don't, you know, the dogs are here. They're all around me, but the cat is not. I don't know where they went. Usually they're like
Pepper some hugs for us too.
They're chasing mice.
Probably, or baby rabbits.
All right, Dr. Roman, we love you so much.
Thank you so much. We'll talk to you soon. Take care. Happy Sunday.
All right. Bye-bye.
Bye now.